I'm sure it's just my asthma acting up. It happened with the last pregnancy, too.
Is this your second?
Yep. Well, the fun this time. Twins.
Congratulations.
Thanks. But they're not mine. I'm a surrogate. Usually Nate and Stephanie, the twins' biological parents, come with me to all my doctor's visits, but I didn't want to panic them over nothing.
Yeah, I hear some scattered wheezes. I think you're right. Uterus is compressing the lungs, exacerbating your asthma. Let's get a med-nab and 40 milligrams of IV methylprednisolone. Now, since you're here...
Ultrasound?
This isn't your first rodeo.
Baby boy is doing somersaults today. Probably the salsa I had with my eggs. Spicy foods always get him moving. His sister, on the other hand, hardly ever kicks.
Celine, have you had your anatomy ultrasound yet?
No, it's for next week. Is something wrong?
The male fetus's amniotic fluid is elevated. That can happen with twins. I'd like to get a better picture of what's going on.
Should I call Nate and Stephanie?
I think that'd be a good idea.
Dr. Halstead.
This is Nate and Stephanie Addison, the twins' parents.
Hi.
Hi there. I'm afraid I have some difficult news.
What's wrong?
The male fetus has something called a congenital diaphragmatic hernia. His abdominal organs have migrated into his chest through a hole in his diaphragm.
Oh my God.
It's treatable, right?
There are surgical options post-birth, but due to the severity of his case, his prognosis is poor. And unfortunately, that is not all. The increased fluid is compressing the female twin, jeopardizing her growth.
You're saying she's in trouble too?
There has to be something you can do.
Selectively reducing the male fetus would give her the best chance of survival.
You mean?
Lose him.
I am so sorry.
Is there a chance things could stabilize on their own if we just wait?
It's possible, but in all likelihood, the fluid will continue to build, hindering her lung development.
Oh no.
The earlier we intervene, the better.
We've decided that,
Celine will have the procedure. We've tried for 6 years to have a child. These were our last 2 embryos. We just can't risk losing both of them.
I'll let obstetrics know. Celine, you all right?
He just kicked. I know it's him. He's always on the right. Wait, stop.
What is it?
I can't do this.
What?
you heard Dr. Halstead. We don't have a choice.
He said there's a chance things could stabilize.
Celine, we can't risk losing both of our babies.
How about we talk this out?
I'm sorry, but I'm not willing to let him go. I can't do the procedure. I just can't.
Here's the clause in the surrogacy contract. The parents have the right to request a selective reduction for any medical reason.
And the surrogate agreed to defer to their wishes.
She signed the contract.
Yeah, but she has since very emphatically changed her mind.
Okay, well, that's the funny thing about contracts. They don't really care if you change your mind.
Yeah, well, I don't care if she signed a thing in blood. Celine is not a human incubator. I won't force a procedure on her without her explicit consent.
You're not going to do anything at all, Dr. Halstead. This is a legal matter now. Let the lawyers hash it out.
I want to make sure you understand you're in clear breach of contract.
I'm sorry, but I think we should just wait and see if things stabilize on their own.
With all due respect, there is no we. It's the Addisons' decision, and theirs alone.
It's her body.
That doesn't give her the right to hold my client's fetus as hostage.
That's not my intention.
Listen, I'd hate to have to bring this to trial, because if I do, you'll be facing severe legal and financial ramifications.
Well, let's take it down a notch, okay? You're not gonna force her hand with intimidation and scare tactics.
Why don't you stay in your lane, doctor? This doesn't concern you.
Oh, no, it does concern me because you're upsetting my patient. You need to leave.
Our lawyer's not going anywhere until we figure this out.
Celine, do you want her to leave?
Excuse me. I'm Sharon Goodwin, Director of Patient and Medical Services. Is there anything I can help you sort out?
Yes, we'd like a different doctor. Dr. Halstead is clearly biased against us.
Well, that's not up to you. I'm Celine's doctor. Only she can make that decision.
Dr. Halstead, can I speak to you outside?
Ms. Goodwin?
Now. You're wrong, Dr. Halstead. You know who else can make that decision? Me. And if the Addisons aren't comfortable with you,
You're benching me?
I'm reassigning the case. Yes.
Unbelievable.
I don't know what to do. I can't afford to be in some long, drawn-out legal battle. Maybe I should just respect their wishes. But I know they don't want this either.
That's why I'm here. I may have found another way. It's an investigational procedure called fetal tracheal occlusion. And if successful, it would allow the twins to reach viability. I mean, it could even help improve the male fetus's lung function. But hold on, though. General anesthesia always carries risks. And because of your asthma, the potential complications are increased. You would be putting yourself on the line.
I know they're not mine. And when it's time to hand them over, I'll be happy too. Because I know how loved and wanted they are. But while they're still inside my body, while their lives depend on me, I have to do what I think is best. I want to do it, Dr. Halstead.
Did our babies make it?
Dr. Dennis will be out to speak with you both shortly, but the surgery was a success. Yeah, both fetuses have strong heartbeats.
Is Celine okay?
Yeah, she did just fine.